So firstly, welcome to this show, Caliph interview.
Thank you.
How are you?
I'm good. Alhamdulillah. I'm good. Thank
Okay,
you.
so quick fact about me and Zaid is that I back then I was googling about hijama of Singapore back then, and
Okay.
the reason why I was doing that is because my dad was sick. My late dad was sick, and I remember the sunnah of blood cupping, and I was like, I had experience back then in JB, but for me it wasn't that good, and I was like, and I was desperate because my dad was very sick, and so I was like googling about hijama in Singapore. There are a few of hijamas out there, but something about I saw about your website that draws me to engage you.
Okay.
I didn't see your Facebook back then. I didn't know about your reviews and everything. So I was just like, I think it's just about the instinct. So I was like, okay, I prayed, and after that I was like, okay, I just get him. So the first thing when you came to my house and you met my dad, and I felt the instant warmth from you, and I felt like instant connection. I felt so like okay, but the thing is that I haven't seen your skills yet. Right? Yeah. So when you start doing my dad, and I was there beside you, spoke everything, talk to you more, and then when you explained to me, I realized that this guy is very knowledgeable about his stuff, right? Yeah. So I was like, okay. So from there, I think we hit off, and you came for the second time.
Okay.
And and I think we from there we get to know each other, and I did for my own self also, my back, and I think it felt good. And I think one thing about you that makes me so respectful to you is that when you know that my dad passed away, you actually like kind of like return back all the you pay back all the fees that I pay you for my dad. I feel for the groceries that you think. I think that is just amazing, and thank you for that again. Once again.
Thank you so much. Yeah.
All right. Anything you would like to say about?
I think that is also part of me, other than treating people with Hijama Therapy, giving charity. I think not only me, but I think most Muslims out there, be it entrepreneur or any middle income personnel, need to do some charity, because we have to remember that we live in this world temporarily, and we need to help others. Of course, we can reach out for every single one in the world, but the closest one, so yep.
Okay, that's good. Okay, so let's start off with for those who doesn't know about hijama, have no clue what hijama is, and just the word hijama, right? Could you just share with everyone the background about hijama, if you may, and what are the benefits?
Okay. Okay, hijama is a cupping therapy. Some call it wet cupping or blood cupping, to be precise. It's different from dry cupping. Dry cupping doesn't have any incision of any needles or anything, or even dry cupping doesn't have any extracting out of blood. And then the hijama therapy extract blood, dirty bloods. Okay, dirty bloods. Those are we call blood clots, thrombosis, scientifically, and all those impurities and toxins in the body. How those, a lot of questions raise up. How those blood actually appear in the body? It's because of all the processed food that we eat every day, carbonated drinks, and even the air we smell. Those carbon dioxide. So our body doesn't design to actually extract it naturally. So we have to do hijama therapy to not only keep ourselves healthy, but it actually prevents like 85% of potential illness. Those illness are like stroke, common illness, gout, and high blood pressure, So I think it's like 76 kinds of illness
76.
that
Wow.
hijama actually prevent from.
Wow.
Yeah. So yeah, that explains. Yeah.
So the word hijama originates from
Hijama originates from Arabic, that means
Arabic.
sucking or cupping.
I see.
Yeah,
So
so-
this originates back in the
Yes, during the Prophet time. So what happened was the angel, Jibril, he always emphasized on Prophet Muhammad
Okay.
to always do hijama. Okay, so what happened was the Prophet was too scared because being reminded by an angel. So he thought like it's gonna be something that is wajib. That means something that he have to do.
Yes, it's a must.
Yeah, it's a must. Yeah. So actually, it's still a sunnah. Okay. So that that tells us how important that treatment
Yes, correct.
from Jibril to Rasulullah.
Yeah.
So Rasulullah always did hijama to prevent himself from headaches, and also there's one point of time Rasulullah actually treat his sihir.
Okay.
Yeah, he's inflicted by sihir,
Black magic.
black magic.
Black magic,
So he treat himself by hijama
Okay.
from the median of the head. Yeah.
So black magic can be cured by hijama also.
Yes, correct.
Nice.
So doing hijama is not only for your health. For Muslims, it's actually also good for your whatever is not good
In
inside the
your
body.
Yes.
I mean, I'm talking about supernatural or any inflicted by any black magic or anything like that. Yeah.
Okay, so why do you think that people are scared of hijama? Especially when they spoke about needles, right?
Okay.
Like why do people?
That's a good question.
Yeah.
Actually, from my experience, I mean, I met a lot of customers. Sometimes I do ask them, or even they told me themselves. Most of them are afraid of the photos.
I see.
Okay, so they saw photos of
blood, especially
blood clot.
Yeah.
I mean, the thrombosis, then all those, you know.
Probably the aftermath of the
Yes, the aftermath of thing. So they were thinking like how this blood actually extract out from the skin. Actually, for most practitioners that they use needle lancets. Some use surgical blades.
Okay.
So
surgical blades.
Yeah, surgical blades, and not razor blade, of course. So those blood actually extract out from all the all the holes that been pricked by the needles.
Okay.
So after coming out from the skin, what it does actually, it actually forms back, and it looks like a big clot. You know, actually.
Because blood when it's exposed to the normal room temperature, it just gets back together, right? The
Yes, correct. Yeah. So that is how it reacts inside the body. You know, when it enters your muscles, tissues, and all the nerve, it actually block your good blood from circulating around the body. So hence it actually give your body poor circulation of blood. And when that happens inside the body, what happened was the oxygen level is also lesser, because oxygen travels to our bloodstream.
Yep.
Okay, so when lesser blood is circulating, lesser oxygen is supplying to the body system.
That's when you feel discomfort.
Yeah, and that is when the body starts to react.
Correct.
And when the body reacts, it starts to have illnesses.
I see.
Okay, so
it's very important to.
Yeah.
That's most people don't know. But how do you convince those who are scared?
Okay.
As a practitioner.
Another good question. Actually, I don't. I mean, from my experience, I don't actually ever once force someone to do hijama. But I did explain what they don't understand about the therapy. So explaining is just like when you are teaching a small kid. Okay, you can't be like you eat this or you drink this milk. Okay, it must be. I mean, for example, okay, milk. Of course, I think all kids love milks.
Yeah.
Okay, we put a scenario like, okay, it's your first time eating an apple. Okay, and you heard that apple is not nice. Okay, but it's good for your health. So it's my responsibility to explain to you that why you should eat apple.
Correct.
So after you taste apple, apple tastes nice and delicious. So that brings you forward to always look up for apple, and don't forget an apple a day. Yes.
So once so the only way for them to try it out, to be convinced, is to just try. It's not that painful, right?
It's not that painful.
It looks painful. It looks unpleasant, but it's not as painful as you think. Right?
Yeah, it's like an ant's bite. Okay. I think everyone at least have been bitten by an insect or anything, and so it's bearable. I can say the pain. It's not like you can't take the pain. You know, I think those other surgeries looks much more painful.
Yeah.
Then they have to anesthetize you.
Right. How often do you recommend hijama therapy?
How often? 3 months is the best.
3 months.
We take it like 4 times annually. Okay, there's no exact frequency, but it's been told that it's good to be done all the time.
Okay.
Some will say like every week, which I think is a bit too much. Some say monthly. So I personally, when I told someone that it's good to do every 3 months.
3 months. Yeah.
Actually, I'm thinking about the financial situation of this generation.
Yes.
It doesn't matter if you're rich or you're a middle income kind of person. I take it on average, you know. So I don't want everyone to think that, oh, I have to do hijama therapy every month. So I have to think that you have to eat also every day, you know. So the best is 3 months.
The best is 3 months.
Yeah, it takes some time for the body to develop dirty bloods, you know. Yeah.
Okay, so a quick one. What are the common illnesses that people come to you for, or you have treated?
Okay, common illnesses. Well, there's a lot actually, but
like you said, 76, right?
That's 76.
But the common ones.
But the common ones was gout attack, gout, arthritis. Those are joint pains of illness.
Joint pains.
Yeah,
okay.
eczema.
Eczema.
Yeah, eczema is skin disease.
Okay.
So, gout, eczema.
Migraine. How about migraine?
Severe migraine, migraine headaches, high blood pressure.
Okay.
Yeah. So these are the common ones. Yeah.
I see. All right. Of all your, how many years have you been in this field?
I've been like 5 years in this field.
5 years.
Yeah.
That's
5
long.
years. Yeah.
Okay, so within these 5 years, I'm sure you have lots of clients.
Yes.
Right? Could you share with me your favorite success stories? For example, if he has a very bad illness, what's your favorite so far that you have?
Actually, there's quite a number of them, but I just name a few. I've treated a lot of patients with eczema and gout or arthritis, but the one that I actually can't forget, because I think this plays a lot of impact on our generations and the future, which is people who can't conceive. So most of them are young couples. So I mean, if we are talking about young couples, we are talking about healthy people, you know. But this generation, with all the food, fast food and everything, it doesn't matter of age. So even old or young, you can be as unhealthy, you know. So there's this three couples, okay, who have infertility problems. One thing is not because they can't engage in any sexual intercourse. I mean, they tried So some of them tried going for IVF therapy. If they go to hospitals looking for doctors for help, you know, they tried many things. They tried TCM, they tried eating medicine and stuff. I don't say those kind of treatment is bad.
Yeah.
Is as good as Hijama Therapy.
Yeah.
But I think it's good that the couple try a lot of kind of treatments.
Correct.
You know, so they know which one works for them.
Correct.
Yeah, A might not work for them, B might work for them. So I did infertility treatment for them. So basically moving, extracting out blood clot, thrombosis from the body actually circulate the body better. You know, the blood. You know, circulate the blood better. So when blood circulates better, even your fertility area for the women and for the men as well. So it helps in the immune system and also the fertility system. So that actually makes them achieve fertility success rate.
Yeah, better success rate.
Yeah, because it circulates smoothly on their system. So there's one couple has not been conceived for about 8.5 years.
8.5 years.
That's the longest among all the one that I did the treatment for. So 8.5 years, and he was when I came to his house, he was like, Zaid, you are the last person that I'm gonna meet. I said, what do you mean? So I said, I have been trying all the treatment, but you are the last person that I hope you can help me.
Yeah.
So yeah, of course, with God's will, with Allah's will, why not?
Yeah.
Okay, so after the session, we had a good talk. I advised him what to eat.
Yeah.
Eat some healthy food, fruits, veggies, and also honey plays a lot of part in fertility.
Yeah.
So after a month and a half, he was texting me personally.
Yeah.
Assalamualaikum Zaid, I hope you're doing good. I said, yeah, I hope you're doing good. So how are you doing like after the treatment? If you feel better? He's got, yeah, I got something to send you. So he sent me actually a photo, then it was like blurrish.
Yeah.
I haven't downloaded it. So when I pressed, I was like, Alhamdulillah. That's the first thing I came up from my mouth. So because I saw he sending a pregnancy test kit and it's positive.
Yes.
So I mean, it feels like crying. It's just like I'm too happy, you know, to see others feeling happy about it. Yeah. So yeah, the second time I came, the kid was already like 6 months. 6 months year old. Yeah.
Beautiful story.
Yeah, beautiful story. You know, it's just like sometimes speechless.
Things like this makes you keep on going.
Yes, things
do.
like this keeps me going every day. Although I'm tired and stuff, but it's normal. I mean, we are working every day. So even sometimes I don't see difficult customers. It's just they gone through certain illness and it's difficult for them. So I try to make things easy for them to cure their sickness. And yeah, most important thing is, as a practitioner, I think not only me, I can advise to all others practitioners, doctors and nurses and everything. The first thing we want to treat someone, the first thing we have to be sincere. Okay, we can't think about money. Yes, everyone does. Okay, because we need to live every day. Because if you think about money, money will kill us. So if you be sincere, we want to treat them or that particular patient, we want them to cure and everything, then the money we leave to God for rezeki. Yeah. So that's what my advice is. Yeah.
Wow. I think it's very hard to get sincere practitioners nowadays. It's difficult. It's difficult when people are, because when you're down with an illness, you're desperate. You see, and when you find and when you're desperate, you spend whatever it takes, to get you treated. And when you go to these practitioners, and they are not sincere, they just want you for the money. I think it's very, very, it's difficult. It's difficult, and to get a sincere one is like a a gem. You know, that's why when I got you, I was like, wow.
Thank you so much.
Yeah.
Jazakallah khair. I thank Allah for this because I think He made every one of us. So yeah, I hope I can stay like this forever.
I mean,
yeah.
Before Hijama, what makes you interested in taking this course before?
Hijama is something that actually I have no idea what is it about. My grandma said to me after I graduated from school, so I was working as an oil and gas ROV pilot. So
you're in the oil and gas industry.
Yeah, so I was an ROV pilot. ROV pilot is an underwater pilot, so they deal in all those checking of pipelines and everything. So I'm almost away, like offshore.
Okay.
So it's Hari Raya first day. Then my grandma asked me, "Do you want to learn massage?" I said, "Why should I learn massage?" Then is it because my grandma is a masseuse, so postnatal masseuse. So I said, "Why should I learn massage?" Yeah, you should learn. It's a skill. It doesn't matter if you are doing it for work or something that you can look forward to in the future. You know, it doesn't mean you have to learn massage. Maybe other kinds of therapy. I said, "Can you suggest something for me that I think not a lot of people are doing out there, and I want something that I can learn more." I said, "Okay, then you learn hijama." So I was like, "What is hijama?" I said, "It's blood cupping, you know." Then he was saying in Malay, like, "It's bekam darah." I said, "I never heard of it. I heard bekam, but it's not the darah thing."
Correct.
So she was explaining to me that this actually is a sunnah from the Rasulullah, Prophet Muhammad. Then I was like, "Really?" I said, "Where's the proof?" I said, "Yeah, I give you the hadith. You go and read about it." So she gave me this book about prophetic medicine. So actually, I quite surprised to see not only hijama, actually a lot of things, even the sunnah foods and everything. So I said to her, "Thank you so much for telling me this, and I think I want to pursue this." So I went back home. I was like, I need to get this done, you know, research. I mean, I don't want to just go to the institute in Malaysia or in United Kingdom to just learn without knowing what actually it does. So I actually self-study, research about Hijama Therapy, what benefits, then why Rasulullah did that, and why the Sahaba did that, why the angels always emphasize on Rasulullah. And I was surprised. It's a miraculous treatment. Okay, I have no idea because that's what they said when I did research about Hijama Therapy. So I actually enrolled for the school. A month later, I was already inside the institute, inshallah. So inshallah in Selangor, we learned Hijama Therapy in an institute by Perhijam.
So did you stop your work, quit your work, or did you do it part time?
I was having offshore projects at that moment, so
you're free.
I didn't go for 2 projects actually.
I see. So you took a pause for a while and go for this thing.
I took a break from the oil and gas industry.
Right. So
then I pursue my education in Hijama Therapy. Yeah. So from there it starts so fast, you know, like I graduated from the school, I came back Singapore, then I already start doing
sessions for people,
Hijama Therapy to people, then and here I am now talking to you.
Beautiful. So when did you make this your full-time career?
I did this full-time about 2 years ago. Okay. I started to work after the offshore projects. I start to work office hours, so mainly in handling paperwork and stuff. So after that, after work hours is hijama time, you know,
so
for people. So I couldn't take as much appointments a day.
Yeah.
So
but the demand is there.
Yes. I took like 2 to 3 appointments. So it started like at night. So start at 8 p.m. So end about 1, 2 a.m. So and I kind of struggle the next day, you know, waking up to my office hour job. So I guess it's quite a big decision to actually decide whether I want to do this full time or not. But I think people around me, loved ones, or even other hijama practitioners who are my mentors in Singapore. So they said to me, if I can do full time, why not you?
I see. They were doing full time, is it? So
they are doing full time. Yeah. So I decided to quit my job and start my hijama therapy full time. Yeah.
When you quit your job, what are the challenges you face? Could you share with me just a few challenges you face?
Okay. When I quit my job, I thought I'm gonna have a lot of challenges. Okay, like, of course, in everyone's mind, like, financially, you know.
Right.
Like, oh my God, what if I don't have any appointments in the day? Then I'm gonna struggle. I'm gonna only find money at night. But I guess because I'm confident enough that there's a lot of people who are ill or sick out there that wants the treatment, you know. Then a lot of people were inquiring about hijama therapy. How do I cure my illness and stuff? So I threw everything negatively, all the negative in my mind. So and it surprises me, like, actually I am more busy now
than
before. Like, before I have 2 jobs, my office hour jobs and my hijama job. So now I am more busy. Like, I start early in the morning and not so late at night. Yeah, so I get a good rest. Yeah.
Okay. What's the vision of Hijama Singapore?
Okay, that's interesting.
5 years, 10 years down the road.
5 years, 10 years. Actually, it's already 5 years. So I'm expanding now in Hijama Malaysia, in KL. So I'm still, you know, processing all the locations and stuff. So it'll be starting, inshallah, in 2019. And 2020 is Hijama Netherlands. Yes.
Wow.
So that is really, like, you know, to the Europe side, you know, of the world.
Yeah.
And it's a big challenge for me because sometimes you know that whatever in Singapore that I did hijama is beyond your means.
Okay.
You know, I mean, I have 2 hands. So hopefully, I mean, in the future, I hope that all the other locations in the world that Hijama Singapore is expanding can have the same quality and sincerity, like what Hijama Singapore does. So my mission is not to be only local but global. Think global, not local. Yeah.
So you spoke about expanding internationally. I think it's a challenge also because coming from you as a very sincere practitioner, right, yourself, how do you ensure and how do you emphasize sincerity to your other branches that you are expanding to on? Yeah.
Okay. I think it all starts from a team. You know, I mean, being sincere myself is not enough. I have to have a whole team of sincere practitioners and people. So how I'm gonna take care of that is, of course, I think every practitioner that working with the Hijama group, or Hijama Singapore, or Hijama Malaysia, I think those practitioners have to be someone who thinks who treat people with hijama to cure them and not thinking about just working a 9-to-5 job, you know. So
the hiring process is
the hiring process is very important. That, of course, I have to interview them, you know, I have to know what kind of person are they and the most important thing is to ask them what's the main problems that they are facing. I think everyone in this world have their own personal problems. As long as there's no serious problems that encountering them, so I think they should be a good practitioner. Yeah, and of course someone who is not that. I'm not asking for someone who is knowledgeable, but at least someone who knows what he or she is doing, and so they can explain to all the patients and inshallah cure them. Yeah.
I see. Any additional health tips that you can share with us, other than probably like food, or you read a lot about. Any additional tips that you can share?
Yeah, inshallah I can share. We look into sunnah foods, the first thing, because that's what the Prophet Muhammad ate, and also that food is actually blessed foods, that Rasulullah eat. Those food are honey, I can say black seed, and watermelon. Those food, before we eat those sunnah foods, we as Muslims, it's good for us to actually do a bit of research, because not all food is good to be consumed at all times. For example, we talk about watermelon. Watermelon is not good to be consumed at night. The reason why, the way the Prophet Muhammad diet is a diet, is a blend of hot and cold food. We are talking about heaty and cold food. Like for example, we're talking about dates. Red dates. So the most common one that Prophet Muhammad eat is ajwa dates. So ajwa dates is considered a heaty food.
Yeah.
So it's good to be consumed with maybe cucumbers, cold food. So not only
it complements each other.
Yes, actually it's more of a balance for the body. Not only for food, even when we shower, we have to see the day. Like if it's in the day, it's hot, we have to shower cold, and it's at night, it's cold, we have to shower hot.
Hot water.
Yeah, even warm. So balance of hot and cold is very important in every human's body. That is the secret, actually. Yeah. So, yeah.
Beautiful. So sidetrack a little bit. Who's your role model?
Okay.
And why?
Role model. How many do you want? Is it like 2, 3, 4?
Up to you.
Okay, I have 2 role models.
Sure.
When it comes to Hijama Therapy. First role model is Prophet Muhammad, of course, because he's living everything on par. Like why I'm saying this, because back then there's no Google.com, there's no Yahoo.com or internet or anything, computers, they don't. But if you kind of research of all the sunnah foods and the sunnah therapy that the Prophet is doing, it's all logical, beneficial to all the humans in the world. It doesn't matter, be it for Muslims, for non-Muslims. I think everyone should learn all the benefits of what the Prophet actually eat and also cure himself. Yeah, so my second role model is my lecturers. So one of my lecturers is from my school, in Shah Alam Institute. So Dr. Yusni, and also I have a third one actually. Is my personal mentor. He's from the UK, Ustaz Ramis Ibrahim. So he owns a clinic in London, the therapy clinic, London. So he gave good advices for those who are English-speaking individuals. Like he knows what he's doing. So these 2 lecturers are the one I'm looking at in terms of my advices or what I should do. And they are humble people. They ask me in return like questions to advise them. You know.
Wow.
Yeah. So I think it's very. I think in this world, everyone should be like that. Not only for myself and my lecturers. I think in everything, jobs or anything, managers and supervisors, everyone should discuss. You know.
Yes.
We shouldn't play the hierarchy way. So everyone should discuss and make things work. Yeah. Then there comes success. Yeah.
Beautiful. What's the best advice you ever received from your lecturers?
Being sincere. Yeah. That's the first thing. That's why I keep emphasizing like why my advice is to other practitioners that they have to be sincere. Yes, I think that's the only thing. Yeah, I mean, we don't trust or loyalty. I mean, that is more about relationships. But I think about Hijama Therapy, first thing is sincerity. Then the second, third thing, it comes by itself. I mean, good things come by itself from Allah. Yeah.
Any last parting words you want to share about anything in general?
In general, okay. For those out there who are watching this video, you can eat anything. Like, of course, something halal, you know, for Muslims. Then, just watch. And we have limitations in this world, like everything.
Yeah.
Yeah. So watch out for your diet. I mean, add more fruits and veggies on your diet and keep yourself healthy. I mean, sometimes we see someone fat, you know, or big. It doesn't mean they are not healthy.
Yeah.
It's just that they have more fats than us. And sometimes we see people who are skinny, you know, and then we thought they are healthy, but they have high cholesterol. So again, that also teaches us not to judge others. You know, it's more about we judging ourselves. Are we healthy enough to judge others? So cut the second thing, judging others, and just remember that one thing. Judging ourselves, taking care of ourselves, and also the best is, of course, we share to our family members, you know, how to be healthy. And it all started from researching, or it all started from Sunnah food and Sunnah therapy, like hijama. Yeah.
Okay. Yeah. That's all. Thank you.
Thank you so much.
Thank you for sharing your thoughts.
Thanks for having me. Yeah.
Thank you, man. You're most welcome.
Thank you.
Are you ready to give me a go?
Yes.